All right. All right, guys. So we are back, and I apologize for that little disturbance earlier. I appreciate your patience while I got that um, assisted in getting it sorted out. Okay. So back to primary healthcare. Primary, as I was saying, I was trying to hone in on some specific words that are important in the definition, and I focused on essential healthcare, scientifically sound, scientifically sound, um, accessible to individuals and families in the community. Community itself is also a part of that definition, and self-reliance and self-determination. All right. So those are some essential words that the make up your definition of primary health care. And the guiding principle is that every citizen has a right to health care as a means of leading a safe and productive life. This is as fundamental and as basic as you can think. We are human beings. For us to be, for one far better phrase, a useful human being, we need to be in positions that are safe. And I want to draw reference to yesterday's lecture on Maslow's hierarchy of needs, where I think safety is the second level of Maslow's hierarchy of needs. You want to feel safe, and you also want to be productive. You also want to live a life that has use and has meaning. And to do those things at times, you need to be, well, not at times. To be productive in life, you need to be healthy. The objective of healthcare is to restore persons' health to a status where they can become productive once again. One of the key objectives of healthcare is to restore the person's health status so that they can be productive individuals again. They can contribute to society. They can add value to the world. All right? And that's part of the guiding principle. And it speaks about equitable access to healthcare services based on needs. Last week we did the ICT lecture where it was introduced in terms of equality and equity. And can someone remind me what's equity about versus equality? Tracy, since you had some serious entertainment in the last hour, tell me what is equity versus equality. Um, or anyone else who wants to help her, I just call on Tracy because she was laughing a lot. Anyone else can help. Tell me what equity is versus what equality is. Oh, nobody rushing to answer now, but just a few minutes ago, you were very much acknowledging the noise in the background. Nobody's rushing to answer. Equality versus equity. Don't tell me you're googling equality and equity. Yeah? We did this just last week. Anyone there? Hello? Shakila. Equity is given everyone according to their needs, and equality is given everyone the same. That's an excellent definition, Shakila. That's a great definition. Karina, equality is giving everyone the same, equity is getting yes. So both of you have given good definitions. Very good. Tracy, we are here from you. It's open to hear from you. Good. So equitable access to healthcare services based on needs. Equitable access to healthcare services based on needs. If you can afford your own healthcare, then you might be asked to pay for your own healthcare. It's similar to, well, the GATE program now I know has been amended to no longer provide equal access to healthcare, to tertiary education. It's now, I think it's a bit equitable based as well, right? If I correct me if I'm wrong, that with the Tracy, I'm sorry, while I was looking at my notes. They do a means testing. Okay. So, if it is for some reason you come from a background that can contribute to the tuition fees, etc., then you pay a certain amount, right? That's what you all go through now with Gates, right? Good. So again, we hammer home the point of equity versus equity, and primary healthcare is about equity, right? Primary healthcare is about providing equitable access to healthcare. Good. The role of the state in primary healthcare, they have a role, the state has a role to partner with local and international agencies and its citizens to meet this objective. So the role of the state must partner with local and international and its citizens to meet the objective. So partnering with your citizens, it's not a one-way conversation. It's a partnering mechanism that the state has to get itself involved in. Ensuring that appropriate policies and programs are in place alongside reliable structures for sustained socio-economic development. Now, guys, this might be new terms for you all. This might be very strange words for you all, but I want you to take it slowly. Ensuring that appropriate policies and programs are in place alongside reliable structures for sustained socio-economic development. Now, sustained structures for socio-economic development. What do you understand by that? A sustained structure for socio-economic development. Anyone wants to make a statement to the class what they think it is? And there's nothing wrong. There's nothing wrong about your answers. It's just you putting it out there, and we are going to now agree or disagree if it's correct or not. So, what do you understand by sustained socioeconomic structures? Socio, society, community, economic, economy, business, development, businesses, trade. So socio-economic structure. Anyone wants to make a guess? Nobody? So sustained socioeconomic structures are having your community economy alive through real means of wealth generation, which would mean you have uh, continuous employment of your community in activities that is now continuously generating um, revenue. And an example of that would be manufacturing business. An example of that would be a business venture that can continuously generate employment, um, and activities that are perhaps innovative and creative based that can now generate new forms of income. So it's structured, it's reliable structures for socioeconomic development. That also includes policy making. Economy should not drive society but support society. Economies are part of societies. Samantha, where you get that quote here? Um, economies are very much part of societies, and do help um, to economies do help to influence Google, of course. Economies do help to for one for a better word, paint the picture of a society. So if it is, we could get a better phrase. Um, Economies they do actually support, and you can sometimes use the word drive to, Samantha, see that they can indeed drive societies, because if you have a community that's in the energy industry or in an agricultural industry and it's thriving, it can actually drive the community and lead it into a particular direction. So economies and societies are mixed, intermingled. And so I was about to make the point that reliable structures for sustained socioeconomic development also talks about laws. And you see on top they mention policies and programs are in place alongside. So you have a sustained um, economic activity. You have sustained economic activity. We also need laws and policies that can help to facilitate the continuance or the sustenance of this economic activity in your community. So that's where the state comes in. And I would have mentioned in a class previous, or your class as well, the state's role is to provide much needed physical infrastructure. The state should be providing things like maybe road development, perhaps electrification, provision of public utilities such as water and electricity, and what we now know, internet is now considered something very essential. So the state are the ones usually who should do those things. If you engage a private sector enterprise to do it, yes, some of them may have the deep pockets to do it, but some of them may not. So the role of the state is a facilitator, and I want to put that in there again. State, state or government is a facilitator. Facilitator. And as a facilitator, remember what I said? Remember what I said about a word that starts with E? When you facilitate, when you have an enabling environment, when you facilitate an enabling, thank you, Chelsea. Thank you, Chelsea. Thank you, Shakila. Yes, you can now have communities empower themselves to provide the goods and services that they determine that they need. But the state does have a role, right? So I just wanted to emphasize that point. The structure that is needed, we're on to slide 5. The structure that is needed for primary healthcare, of course, would be health resources, manpower, that's a given. You would need facilities, equipment, supplies, of course. You would need organized arrangement of health resources. You would need sometimes integration of private and public healthcare services. You would need a delivery of healthcare through the media of primary, secondary, and tertiary healthcare services. You would need economic support through public financing and foreign aid. You would need management through strong leadership. So let's go through each of these. The first one is a given. You need health resources. You need a physical, sometimes a brick and mortar facility. You need manpower, you need equipment, and we spoke about ICT and what ICT can do. It can sometimes reduce the need for the amount of manpower that you might have to send to a rural area, for example, or um, you can deploy ICT to assist in reducing the amount of equipment that you may have to now put out in different areas. ICT can help with that. Two, arrange. So I want you to get in your mind. The structure is develop, or arrange, deliver, support, manage. Develop, arrange, deliver, support, manage. Develop, arrange, deliver, support, manage. So you then need to arrange your health resources. You then need to arrange your health resources. And we have words like health authorities. We have health authorities here in Trinidad. Um, National health insurance, which is national insurance that you pay when you work. Integration of public and private healthcare services. So in our country, we have attempted to decentralize healthcare from one governing. Well, we tried, but essentially it still is being run from a centralized process where the Ministry of Health now dictates the direction for all of the RHAs, where the RHAs were actually supposed to be a lot more independent, and they're supposed to operate like independent bodies that are serving unique needs of their community. We still have um, centralized structures that are affecting your RHAs. Provision of national health insurance. Well, we still don't have a real national health insurance coverage. We have very, very basic contributions that are being made through your health surcharge, and we mentioned what the health surcharge is like a vapor, a vapor droplet in the amount of money needed for health insurance. Integration of public and private healthcare services. um, Sometimes the states, they are unable to provide certain services, and especially in the field of radiology, especially in the field of pharmaceuticals. Not all the time the state is able to provide that type of service, and they now include the private sector to get the scans done, to do surgeries. Right now, there is an active relationship that occurs between the state and private enterprise for dialysis, for radiography, for heart surgery. Okay, so public-private partnerships. Delivery of the healthcare through the media of primary, secondary, and tertiary healthcare services. So delivery of healthcare through primary, secondary, and tertiary. And what do we mean by primary? What's an example of a primary healthcare service? For those of us who were in my class in summer, who may have had the benefit of discussing with some of your colleagues who were in this class, what's an example of a primary healthcare service? Guys, What's an example of a primary healthcare service is one that is the very first point of contact and can provide someone with basic healthcare interaction. What's an example of that? Yes, your private doctors, and yes, your pharmacists. Those are easy examples of primary healthcare services. Clinics, small clinics. Those are examples of primary healthcare service where you come in, you can get access to health information, you can access very basic minor healthcare services. That's primary healthcare service. What's an example of a secondary healthcare service? An example of a secondary healthcare service. Tracy, are you saying a nurse is an example of a secondary healthcare service? Tracy, I want you to give me an answer, which is what you mean by nurse, right? No. A nurse is not a secondary healthcare service. A specialist, a specialist, specialist clinic is a secondary service. A hospital clinic is a secondary service. A medical website is not a secondary service. It's not even I wouldn't even consider it a primary healthcare service. Maybe if the medical website can actually do stuff more than just provide information, can actually do things more than just provide information, then yes. A dentist would be a primary. Dentist would be primary. Renal clinics would be Tracy. Tracy, a nurse would be considered primary, and remember, nurse practitioners they don't have interactions on a one-on-one basis with patients like pharmacists and doctors do. So remember, the nurses more they more assist with the caring of a patient. Shakila, cancer treatment would be considered. Ambulatory cancer treatment would be considered secondary. I would want to lean towards that being tertiary, but ambulatory, where you just go for your treatment and you come back home, would be considered secondary. So essentially, primary is your first point of contact, right? Your first basic point of contact for healthcare. Secondary is where you have a little more services being offered, things like lab results, things like getting IV fluids, things like being monitored on during the day. Maybe a place where you could go in and have a baby and go home the same day, or some of those things. Vikash is saying therapists and psychologists, those would still be considered primary. Well, primary to an extent, because they are specialists. So it can transition between primary, secondary. So secondary is, as I said, is a higher level, is another level of the type of healthcare that you receive. So yes, clinics, yes, lab, yes, a place where you can get clinics, lab results, IV work, IV is done, but it does not have overnight stay. So then you go on to tertiary healthcare services, where it's now Tertiary healthcare services is like a general hospital where you can have primary and secondary services being used as well, but you also have wards, you have overnight stay, you have weeks of stay, you have complex surgeries being done, you have many specialists employed and working there. So that's the difference between tertiary, secondary, and primary healthcare services. All right? So primary, secondary, and healthcare services, I hope you all understand the different tiers and the different levels. Economic support through sources such as public financing and foreign aid. Now, public financing is the revenues that you get from your taxes. Public financing is what you get from your royalties and your health surcharge, etc. Foreign aid. Foreign aid comes from international bodies that would like to donate, and it's called aid, so it's a grant. They would like to donate to your country for perhaps certain healthcare projects that they are aligned with, or they are encouraging globally. And what are some of these examples of international agencies that can give foreign aid? Tell me some examples of international companies that provide foreign aid. Come on, guys, some examples of again, Google sticking. First aid. Maria, where are you? Maria, where are you? First aid. We said foreign aid. We're talking about economic support. Right. Maria, Red Cross. Red Cross. Red Cross. Are they Red Cross really? Banks? Um, some international banks, Sabrina, some international banks can do and get themselves involved in donating money to developing countries or to countries generally for for development of their healthcare system. So the correct answers would be IMF, Shakila. I think IMF, IMF, they don't necessarily give aid. Remember, IMF is an organization that wants to um, hmm, they're more of a lending agency. So UNICEF is United Nations based. I'm surprised nobody here threw out the obvious answers. So Red Cross, guys, I think Red Cross, those are charitable organizations that they receive funding. Children's Authority, that's not foreign aid, Chelsea. Children's Authority is a local agency. So yes, the World Bank, Karishma, we'll take that answer. World Bank actually does at times provide some funding albeit they may try to do it as a loan, but they do sometimes provide some funding. And I think, Shakila, to answer you, IMF sometimes would do some funding, and we saying funding as in grants. Who gave COVID funds recently? World Bank, okay, as in give us, right? Not a loan. Oh, Jahil, you're in the game. WHO. WHO, they provide grants. WHO has a host of countries that provide funding to them, and they now can determine where they can give this funding to help with certain countries with certain programs. Who else? Jahil, WHO, and its its sister organization, PAHO. That's right, Chelsea. WHO, PAHO, UNICEF as well. Yes, they would do some stuff. And Karishma is saying World Bank. And IMF maybe to an extent. I still have to confirm that, Shakila. Okay? But I don't think Red Cross, I don't think any of those charitable based organizations can be in a position to give aid. So the foreign aid comes from the large international health-based organizations, WHO, PAHO, World Bank, UNICEF, etc. Okay, UNDP. This is another one. UNDP, United Nations Development Program. They also have access to funding that can. Right, other countries, yes. They call it health diplomacy. So Vikash is talking about health diplomacy. Um, so they might want to give you funding for something, but they would want something in return. And we all know who is the biggest country that likes to engage in this type of health diplomacy. They're doing it right now heavily, or at least they're trying to do it heavily right now. Which country is this, guys? China. US are engaging in diplomacy. US just they helping out people, yes. But they may only want better deals in return. But China is China it will be negotiating very hard to be able to get access to some of your territories if it is they give you health assistance in return. We know that's the modus operandi of China. So good. So we getting somewhere. We having some nice discussion. Management through strong leadership, policy formation, regulation, and M&E. Strong leadership, guys and gals and guys. We are always in need for strong leadership. Leadership is the answer to get us out of our problems, no matter what type of problems that we're in. You always need good leaders to take you out of your problems, and you need good leaders to guide you in a particular direction. So leadership is something that it's a separate course that people do post-graduation. It's postgraduate leadership and entrepreneurship. So leadership is important. Leadership is a separate subset of management training. And leadership is important to get the effect of primary healthcare accomplished. Policy formation, creation of policies and laws, regulation, monitoring and evaluation. So the take home of this is develop, arrange, deliver, support, manage. Right? And you would need to know the differences of primary, secondary, and tertiary healthcare services. You may need to expand on any one of these. Good so far? Right. And then we need to talk about the social determinants of health. Feinstein and Kaplan spoke about, and I'm going to read it out. There's a relationship between health and social conditions. You might think that's obvious, but for some persons, they may not see the link. Here we're going to talk about the link. Housing, overcrowding, sanitation, Your transit mode, how do you move from one place to another? Occupational hazards, environmental hazards, education, income, employment, lifestyle practices were all identified as critical social factors that influence health status. Let's look at each of them individually. Let's start from lifestyle practices. We all know that the burden of chronic disease that we spoke about last week in health financing, chronic disease is strongly related. There is a linear relationship between bad lifestyle practices and chronic disease and mortality. Excessive smoking, poor diets, lack of exercise, lifestyle practices that can increase the burden of disease on society. Employment, the type of job that you do can impact your health. If you are a miner in a state, in Guyana and in some countries that mine coal, what can you develop? You can develop lung issues. If you are an employee in a chemical industry, you can develop skin issues. You can develop lung issues. The type of work that you do can impact on your health. Income, the amount of money that you have available to you can impact on your ability to purchase healthcare. Something as simple as pharmacists, guys. Something as simple as medications. If it is you simply cannot afford to purchase a medication that you need, then it's going to impact on your healthcare. And you can think of the absolute very basic, and we can talk about countries like Pakistan. In countries like Pakistan, make a wild guess of some of the things that people still die from in Pakistan. And Pakistan is just one country. We can talk about, because it's one that I know for sure is a fact that happens. Something simple. Think of a very simple ailment that someone can have, and because they don't have any funds to purchase this very cheap medication, that they die. That people die, babies die, adults die. Anyone can make a guess for us? I guess Google's sticking again, eh? Anytime I see a anytime I see a delay in answers, I know it's cold and flu. Um, flu, flu. Yes, Shakila. Yes, Shakila, flu. And believe it or not, even in the mighty United States, um, measles, influenza. No, I don't think measles are a problem in countries like that where you have vaccinations. I know there are some countries that there's this group of people who are the anti-vaxxers. I don't know if I am allowed to give my opinion on that, but no, it's not measles. Influenza, yes. Influenza can, yes. Easy access to medication. I was trying to get at something else. Any more guesses? Dengue, um, not so much. TB, not so much. Something simple, something very simple. Chicken pox, I don't think so. All right, no more guesses. So the answer is diarrhea. What happens when people get diarrhea? When they have when they have excessive diarrhea, not blood pressure, diabetes, dehydration. Yes, Tracy, we're getting somewhere. We're getting somewhere. Dehydration. And when you get dehydration, that's continuous. You have continuous diarrhea, no rehydration. You can have some serious issues. Yes, dehydration. Dehydration, IV fluid replacement. Well, that's IV. But even Chelsea, before you even reach IV, there's something simple you could do. There's rehydration salts that you can access. We have them here, Prolite, Genhydrate. You can make your own rehydration salts. So these guys don't even have access to information. Yes, they don't even have access to information that they can use to get them basic home remedy for rehydration, and they can collapse and die out of fluid loss, electrolyte imbalances causing cardiac problems. So something as simple as dehydration can lead to an unnecessary amount of deaths in countries like that, and it still exists today. All right, good. So I just wanted to bring in that point of income, education. If you don't have, sometimes I shouldn't say if you don't have. There is a link between the level of education that you have and your ability to maintain good healthcare status. I remember marking a master's student paper that looked at education and the ability to access or understand healthcare information. And there was a link between higher levels of education and understanding of healthcare information and accessing healthcare. So that's something that you could look at as well. Um, Environmental hazards. An environmental hazard. What's an environmental hazard for you in your community? Could it be a pond or a river that's nearby that is an environmental hazard for your young children that might go and drown? Is the pond or river nearby an environmental hazard that can cause flooding and bring rats and rodents into your household and bring diseases such as leptospirosis into your household? Environmental hazard, does it breed mosquitoes? That's what environmental hazards are, right? Um, Occupational hazards, the things that the things that you have in your workplace that can cause you to get hurt and to get injured whilst doing your job. Occupational hazards. Transit mode. How do you go about moving from point A to point B? Do you use a bicycle on a highway? Is it safe to use a bicycle on a highway? Is it safe to use a vehicle that it's overcrowded? Are you living in an area where people have to be sitting all on top of the bus, and then you have to drive on a very narrow? You've seen the videos online. You have to drive on a very narrow road to get to your workplace or get to your home. Transit mode. That can impact on your health care. You may have to be in a cramped condition on a bus and be amongst people who may have viruses. Transit mode. Sanitation. How clean is your area that you work in? How clean is your area that your home is in? Is there regular garbage collection? I know some of you may live in or know someone who lives in an area where garbage collection is bad, where you don't have access to running water. All right? Where you don't have access to running water, so you can't bathe regularly, you can't wash clothes regularly. And I know for a fact there are some societies in our country, some prominent societies as well, that don't get water for weeks. They don't get water for weeks. So if it is you can't afford to buy a tank and have a pump, and you don't have any connections to get the water truck to deliver water to you, what's your position? All of these things impact on your healthcare status. Next, we have overcrowding. Overcrowding can be in the metropolis areas, in your sometimes in your workplace as well can be overcrowded. Your the areas where you have to travel can be overcrowding. Overcrowding of certain communities can impact on your healthcare status. What are some countries that are considered to be overcrowded? Overcrowded countries. And tell me some countries that are undercrowded. New York and coronavirus. New York was, yes, New York is a highly dense place. India, yes. Sarah, yes. Chelsea, India, yes. China, very overcrowded. Yes, correct. Good answers, guys. And the last one is housing. What's the condition of your housing status? Do you have a house to live in? Are you safe? Are you comfortable? Is your house protecting you from the elements of rain and sun? Is your house protecting you from the elements of Sahara dust? Is your house protecting you from flooding? All of these are social factors and social conditions that help determine your healthcare status. All right? And next, also globalization, the socio-political context of culture, labor market. Let's look at the globalization and socio-political context. We have migrants into the country. We have plenty migrants in our country that are in the labor market, that they come with their own culture. They come with their own family and social system and values and support systems. They also have an effect on housing and overcrowding and sanitation as well. Some barriers to development and implementation of primary healthcare would be income, social cohesion, food availability. Believe it or not, there are persons in our country right now who do not know where their next meal is coming from. It might seem drastic, it might seem strange, but it is a reality. Gender imbalances, living and employment, working conditions, all of these are barriers to adopting healthy behaviors. All right? And the challenges and the limitations that exist. There are 5 challenges and limitations: economic, your debt, your foreign debt versus your local debt, your revenue shortfall. We spoke about it in the class previously in community about your revenue shortfall. How does it affect your ability now to spend on treating diseases? Political will, the second point, the second challenge, and I talk about this all the time. Political will, yes, Shakila, China. Political will. And political will and management will is that desire of those in authority to redirect funding into areas that would be targeted to treat with issues at the earlier stages of the problems. So we having a problem of diabetes and high blood pressure in our country. Redirecting the monies towards educating your younger folks on making better lifestyle choices. You have an issue with the amount of murders in the country. Redirecting your resources to ensure that areas are more secure and there's a less likelihood of gang violence occurring and gang behavior developing. You have an issue with road accidents. Redirecting money to ensure that there is traffic wardens on the road, there is highway patrol, there is cable barriers on the highway that's maintained. All right. So political will is about shifting spending and redirecting resources and using technology to help manage problems at an earlier stage before they reach into being a really large burden. Human resource challenges, of course, we'll always have human resource issues. Um, Unfortunately, pharmacists are now becoming a surplus issue in our country. And I want to take this opportunity to encourage you all to look at your opportunities globally for work. But yes, human resources are challenged in implementing primary healthcare. Maybe your farm as a pharmacist, you can now be repurposed by utilizing more of your skills other than the traditional roles, more of your skills in rolling out primary healthcare services. Public policy development and infrastructure. Always a challenge to get good policy in, always a challenge to get good infrastructure in place that costs that doesn't drain your resources. Environmental and urbanization are real challenges to ensuring that shanty towns don't develop, to ensure that that you have appropriate facilities for waste and sewage management, that you have good safe water supply that's regular, that you have good infrastructure such as roads. Your culture and your lifestyle is a real challenge. Fast food chains, use of alcohol. In Trinidad and Tobago, we love a lime. We love to lime, and limes always involve food. Limes always involve sometimes alcohol as well. In some cases, limes, you engage in a lime and you engage in risk-taking type behavior. All of these are challenges. Changes in the family structure, guys and gals. The family structure is 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 being attacked, where there's now the glorification of lawlessness, and that is contributing to some of our younger folks coming into this belief that lawlessness is a good way of life and a glorified way of life, but it's essentially leading us down a path of early mortality. In our Caribbean, we have issues such as early sexual initiation, unprotected intercourse, and risks of teenage pregnancies. Do you know that in our country we have a very, very high amount of teenage pregnancies, and it's an issue for us per capita when you compare us globally? So these are all very real challenges that are associated with the implementation of primary healthcare. So primary healthcare, guys, is about understanding your lifestyle, is about having an appreciation of your role in the community, of taking charge of your life, of being aware of the things that can affect your healthcare status. And this part about the social determinants of health are real occupational and environmental hazards, education, employment. These things are real things that can affect your healthcare status. All right. So with that, I complete today's lecture, and I now invite questions and queries. Any questions? Any queries, guys and gals? I keep saying guys. Guys meaning plural, right? Any questions? Any queries? I hope you understood today's material, and I hope you have a better appreciation for what primary healthcare is. I hope you have a better appreciation for what the social determinants of health are, what primary, secondary, and tertiary healthcare services are. Any questions, any queries? I want to thank you all once again for your patience with allowing me to just sort out my little one outside. Um, Much appreciated. No questions. Marie, you and your red cross or first aid question. Thanks, Karina. All right, no question. Yeah. Yes, Tracy. No questions. All right, good. Cool. Jahil. All right, good. Nice. So see you all next week, and all that in it. Yeah. So see you all next week, and I wish you the best in your first in course assignments. Um, and hope you have a great weekend. All right. So you all could, as I said, as usual, feel free to message me. I will be very careful not to answer questions related to your exam, but still feel free to message me to as I can assist wherever I can. It's two questions, yeah, two questions. Right? So if you have no more queries about today's lecture, I leave you all. Goodbye. I'll wait one more minute if there's anybody have any questions. Sure, Dylan. All right, good. So no questions. I'll see you all next week. Have a good weekend. Have a good day. Take care.